The Arizona Department of Health Services is on high alert right now, as COVID-19 cases are trending in a way that threatens another lockdown. Jacob Holter spoke with one expert about what this means for the state.
With Thanksgiving just over a week away, this new COVID-19 spike presents a host of new challenges for Arizona, according to the former director of the Arizona Department of Health Services, Will Humble.
The trajectory that we're on is already pretty bad and already looks much like what we experienced in June, which led to the hospital crisis in July. What we didn't have this summer was something like, Thanksgiving in the middle of it all. And I think it's that combination of both the trajectory that we're currently on, along with this new event, which is a big, big deal, and where there will be a fair amount of social mixing, throwing that also at the trajectory.
What has health officials concerned is that hospitalization spikes tend to occur about 2 weeks after the increase in cases, and then deaths tend to follow in the weeks after that. Canada had its Thanksgiving last month, and in the weeks that followed, the country has seen an explosion in COVID-19 cases, reporting over double the number of daily cases that they saw in their coronavirus spike in the spring. Humble is concerned for what that could mean here in Arizona.
I think it's a pretty dangerous combination, and I don't know what you can do about it. I mean, I've thrown out these ideas about, doing better compliance and enforcement at the bars, restaurants, and nightclubs, and statewide face covering mandates. But if people behave irresponsibly at Thanksgiving, and if there's a lot of social mixing, there's no policy intervention for that.
Humble said that this may very well lead to a hospital crisis in December. Despite this, Humble said he does not expect another stay-at-home order, the likes of which we saw in April, but instead sees another shutdown of bars and nightclubs and further reduced capacity in restaurants like was seen in the summer months. Jonathan Nez, president of the Navajo Nation, spoke on the more drastic measures he is taking to combat the virus.
We are now in a three-week curfew lockdown. That's because we have the ability to govern ourselves and to make decisions for the best interest of our people. And of course, it might be strict and might be tough, but we don't have people out there protesting on the streets because they know that these types of stringent public health emergency orders do work to bring the numbers down.
Banner Health said in a press release that they expect to need double the amount of nurses than needed during a typical winter as they brace for the next big wave of COVID-19 hospitalizations. In the studio, Jacob Holter, Cronkite News.